Hello. So today we're going to be talking about cars and pails and rails. So excuse me for the poorly lit room, but we'll make do the best that we can. So to start with, we're going to be doing cars, controlled articulated rotations, and that's essentially to kind of wake that joint up. Um, it's to get it's essentially to preserve the motion that you already have within the joint. So it can be used as a warm up. It can be used after pails and rails, progressive or regressive angular isometric loadings, where those are more so getting the tissue and things like that to open up to get more of that, more ability to rotate. The cars are there to help you kind of like maintain that. It's helping to kind of re-educate, I guess you can say, the neuromuscular tissue. The It helps break up. Nah, I wouldn't say break up, but maybe loosen up fibrotic tissue in the joint. And overall, like Keith and Sinead have said, it's just good for overall joint health and hygiene. You can do this every day and feel better for it. So the principles of cars are, like I said, to help get more so joint motion. So when we're talking about cars, we're talking about three levels. We're talking about level one, which is more so just hammering down the motion, getting more motion down. Number two is more so focusing on irradiating a little more, progressing that irradiation. And number three is when you start to load the motion itself. So we'll go into that. Okay, so as we progress, we're what we can do, like in phase one, we're irradiating, right? So basically, we want our joints kind of stiffened. It doesn't have to be 80-90%, but you should feel stable in all of your joints. We're kind of squeezing our core and stuff like that, and that's to help irradiate and give us that, like proximal stability, which helps us give us the mobility of the joint that we're working, right? So we're making fists, straightening our elbows, squeezing our core, things like that. All right. So if we're going to start with cars, we'll start with our cervical spine. So the way that a car goes for this is essentially we're scraping the four corners of our joint. You could think of it that way. So we're going to go into flexion, and we're doing these slow. And the way a car works is you go one way and then you go the other way. That's one car. All right. So we're going to start with cervical flexion. We're going to scrape our chin along our collarbone, so we're getting that rotation. We're going to drop our ear down to that same side. Bring it back into extension. We're going to rotate now it's to the right. Drop down. Back into cervical flexion. Now we're going to go the other way. So scrape your collarbone. Bring that ear all the way back. Cervical extension. Drop that other ear. Chin down. Into cervical flexion again. That's one car. We're doing these kind of slow. This is not a speedy process, but we want to work slow so that our nervous system gets used to the idea that we can move in these available ranges and just kind of keep them. So the next thing that we can do is a shoulder, or let's do a scapular car. Okay, so we did our neck. Now, same thing. Our shoulder blades do elevation, depression, rotation. Elevation, depression, protraction, retraction for the most part. So let's work in those ranges. So now we're going to go up. We're going to go all the way back, down, and forward. And then up again. And now we could go down, all the way back, all the way up, and forward. And as you can tell, I'm irradiating my joints. So we can be holding objects, balls, blocks between our feet, our knees and stuff like that to really kind of get those contractions so that we're really isolating those joints. That would kind of be phase 2. Phase 3, I mean, it's going to be hard to really load these. I guess if you had dumbbells for these, it's going to be hard to load your neck. But for like your shoulder and elbows and wrists, that gets a little easier. So when it comes to your shoulder, now what we're trying to do is we're trying to really work in all of those, I guess they would be 3 degrees of freedom. We're trying to get the rotation piece, the adduction piece, and the flexion extension piece. So irradiating, right? So I'm working on my right arm. We're going to start in an adducted and externally rotated position, okay? And we're trying to stay as much in like that end range external rotation as much as possible. So we're moving slow. For all these, we're moving slow. You know, I remember Keith bringing up that it's kind of like moving through molasses, and we can move slower and slower as a progression. So we're coming all the way up, irradiating the rest of your body. So we're keeping that shoulder tight. So we're in flexion now. All right. Now, once I get into max flexion and I can't get any further, we're going to internally rotate all the way, bring it all the way back, and I'm internally rotating and extending. So one good thing, as you can see with me, I am completely into horizontal abduction. You can have like somebody do it against a wall to kind of get that pure extension. So if I was here and I was next to a wall, then I would have to force myself all the way back here, full internal rotation, and back. And this is another one, try not to get your spine moving too much. We're irradiating so that we're really isolating that one joint. Now, again, if this is a car, we got to bring it back. So, full internal rotation, extend, 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 extend. Good. Now, I'm stuck here. Now, we're going to externally rotate, bring it up, irradiating, keeping those elbows straight. Now, we're keeping that full external rotation and coming all the way back down. Okay, so that's one car for the shoulder joint. Okay, so now we're going to be moving on to the elbows. We're going to be doing our elbow cars. So in this, you can start in this flexed position, right? And what you want to make sure, what's most important, is that your shoulders aren't really internally and externally rotating to compensate for supination and pronation. So what we're going to do is, as we get into better lighting, we're going to start in a flexed position, fully supinated. Okay, we're going to come all the way down into extension. Okay, now we're going to fully pronate, and keeping those shoulders locked, we're irradiating. We're going to come all the way up and back, and then we would go the other way now. So we're here, all the way down in pronation into extension, fully supinate, and back. Okay, next what we would do is forearm pronation supination. So we're kind of like in this 90 degrees elbow flexion position right here. Okay, so what we want to work on is making sure that we're not, we would put like our phone or a wallet here or whatever it is, something that wouldn't drop, right? So we're going to ulnarly deviate, come all the way up. Okay, so now what we're going to do, we're going to move on from elbow to our wrists. So in this 90 degree, we're kind of supinated here. So we're going to go into ulnar deviation. So we're bringing our pinkies together. Again, irradiating everything else. Okay, so I'm getting stiff. Good. Bring that all the way up into flexion. Okay, then a radial deviation and down. Then back up. Radial deviation into flexion. Ulnar deviation. And finally down back into extension. So the final thing that we're going to work on as far as cars in this video is our spine. So we know that numerous studies show that thoracic and lumbar spine play an integral role in how our appendages move as well. So this is also very important. So we're going to get our arms folded. Okay, Now we're flexing. It's not so much a hip hinge, although you can hinge back for balance, but you're pretty much trying to flex the segments and vertebra of your spine. Once you get to that max flexion, you can side bend. So you're gonna, I'm side bending to my left. I'm going to turn my left shoulder back like this. Good. Max out into extension. Bring it all the way over. Turn that right shoulder back now. Okay, so we're fully rotated. Now we're into that side bend and bring it back into flexion. Now we're going to go the other way. So we're going to side bend, bring that shoulder back, bring it all the way back into extension. Good. Extending all those vertebrae as much as possible. Dropping that left shoulder back, side bending that way, bring it all the way down into flexion. So, as we've stated, this hasn't been stated before, but this is more so a active kind of facilitation for our patients. So we're not really going to want to be touching them. We can kind of guide them, give them little taps and things like that for tactile cueing, but we're not really moving them through so much. This is something that they're going to want to feel, and we want their nervous system to kind of wake up and recognize that they can get into and maintain these positions so they can control it in the future. So once we get done with that, we'll move into our pails and rails. Pails being progressive, rails being regressive, either antagonist or agonist, isometric loading. So basically what this is we're stretching our antagonist in this scenario. So if we were doing shoulder flexion, we are stretching our antagonist. I'm not really sure if that's right, but either way, if we're in flexion, we're stretching our lat, right? So we're going to stretch no matter what this muscle is called for 2 minutes, okay? Going to get that nervous system kind of toned down, get it, telling it that we can use this, we can get into this position and that it's okay. And then from there, once we're in our end range, what we're going to do is to further kind of facilitate that controlling and gaining this new motion, we're going to contract that antagonist. So now we're contracting into shoulder extension. We're going to hold that for about 10 to 20 seconds. We'll ramp up maybe 5 to 10 seconds, hold it for 20. And again, this is in end range. So you don't want to see any motion because this is isometric. So we're going to contract, and then at end range, now we're contracting our agonists, where we're trying to shorten. This is the same thing, another kind of quick burst, 10 to 15 seconds. All right? So for the shoulder, it would look something like this. Okay? So I'll open this door. And as you can see, right here, I'm stretching for 2 minutes. I'm in end range. Now I'm going to push into the wall. Push, holding for 10 seconds. And I'm going to come, if I'm in end range enough, I'm going to think about coming off the wall. Nothing's moving. And hold. 15 to 20 seconds, and you can do that about 2 or 3 different times, or it's just to pretty much help facilitate that new range. Okay, so I use that shoulder flexion example just to kind of demonstrate the pails and rails, but we never want to skip out on the cervical spine, right? So that same kind of concept shows through in our pails and rails also. So we can do our cervical spine where we stretch again for 2 minutes, especially if the patient couldn't get there. If they're getting chin to chest, most likely they don't need this. But if they weren't, they're stuck here. We're stretching, okay? Isometrically. Now we can put, like our hands on our head, pushing. That is, I'm sorry, we would be pushing backwards first. So this is our pail, okay? We're kind of activating the neck extensors, turning those off. So now we can get more neck flexion. And again, if this is end range, we're not moving. We're just not. So I shouldn't even really need my hands there. Same thing with cervical extension, rotation. I'm sorry, side bend or rotation. Now, we can further focus on the shoulder blades, scapula, and shoulder. So if we were working we're working to get more protraction, right? We're working to get more protraction. So now I'm just kind of holding on to a surface, right? We're getting into that full protraction all the way forward. We're stretching out here for 2 minutes. Okay, now we're pulling into retraction now. So retraction, go, 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 go. Good for 20 seconds, and then pushing. And I think this would be better served if you were kind of like in a staggered stance, so that when you push, you don't fall over. But now you're pushing into more protraction. If we were doing elevation, so we're stuck here, right? I'm sorry. Yeah, let's say that we were elevated. So we're trying to get depression. So we can bring our arms down like this and pull down, or we can hook onto kind of like something heavy, hook our hands into something heavy, and then kind of stand up, and that's stretching us into depression. Stretch, 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 20 seconds. I'm sorry, 2 minutes. Then we would pull up. So we're now trying to get elevation, and then stretch, contract even further for our rails for another 15 seconds. If we were trying to get more retraction, then it's kind of the same concept. So we're stretching, we're back here, right? And now we're grabbing on, and we can just kind of like walk ourselves forward. And now we're into max retraction. So now we're just going to stretch and relax as much as possible, turning off that central nervous system. Maybe some deep breaths, stuff like that, to really get yourself to relax. No pain face. Now we're thinking about protracting. So we're protracting, pulling in, ramping up to 20 seconds. Okay, and then now we're going even further. And again, we're at end range here. So no motion. No motion for either the pails because we're stuck behind us with the chair, or with the rails because we're at end range. We could move on to our shoulder where, excuse me, I will actually get a towel. So if we were to get a towel, what we could do, and this would, I'm sure that this would take a little bit of just like patient education, but we can roll this up lengthwise like this. And now, so let's say we're working on this left one. So now we're pulling it back like this. So this is to get external rotation, right? So I'm gripping here and getting external rotation. So 2 minutes, hold, 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 hold. Now, we're going to do our pail. So we're going into internal rotation. And then once we get done with our pail, now we go into our rail. We kind of let our hand off, go into our rail end range. As you can see, we're not moving. Now we could go to internal rotation. So we can do that same thing, or we can demonstrate a sleeper stretch where we would lay on our side like this. We'll have a pillow or two supporting the head, right? So we're stretching, and again, depending on, this can be a little impingy in this portion. We can be here at 90-90. We could bring it a little bit lower down here to comfort. It depends on, the range that they're at. And now we're stretching. internal rotation, okay? And the block is just your hand. So 2 minutes, we'll push, kind of ramping up our intensity over time into 20 seconds, and then now it's our rail. So as you can see, I really didn't get much motion there. We don't want any motion at all. Again, isometric. That's for our shoulder, external, internal. I already did flexion. We can do extension from back. It's very similar to the shoulder scapular depression. So we come all the way back, good. And now when we stretch this for 2 minutes. Now when we want to do our pail, we think about driving our arms forward, down into the chair. Hold, 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 hold. And now we're going to bring our arms all the way up, 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 up. Okay, so that's, that would be extension. We can also stretch out particular muscles. So we kind of did shoulder flexion, and that worked on our lat, but then we can also do it in a child's pose position. So it's just kind of the same thing here. And we sit back, and now from this position, once we're done stretching, and we want to do our pail, we can push into the bed or the floor. And if we're accurate with our end range, we try to lift up for a rail. I cannot move 1 inch further from here. So that's stretching out our lats. We can stretch out the 2 heads of our pec. So when it comes to the, oh boy, I'm going to say this is the sternal portion. Is that 90 degrees? I get the heads mixed up, but if we're here, right, and we stretch out, so the classic one, I guess, would be the doorway stretch. I'll move this like that. So I would stretch out my left arm like this. Stretch, stretch, stretch. So this is stretching our chest. Our pail would be pushing into the wall. Our rail would be trying to lift our arm off the wall. Right? So that's for these. I believe that's the sternal part. And then this is, so at 120 degrees, same kind of concept. Now we're getting our clavicular, I believe. Although, again, admittedly, I could have those mixed up. Stretch, stretch, stretch. 2 minutes. 20 seconds, we're pushing into the wall. And then 20 seconds, we're trying to come off. And as you can see, no motion at all. We're trying to lift our whole arm up, not just like our hand. That's more so external rotation. We're trying to lift our whole arm off into more of that horizontal abduction slash flexion piece to really get that second head of your chest. Okay, finally what we're going to touch upon is our spine, so we can work on our rotation piece. We can work on our elbows, and we'll work on our wrists, considering we touched upon our neck, shoulders, chest, and scapula already. So if we wanted to work on, let's say, rotation, then we can just lay on our bed, floor, whatever it is, and we're just working on disassociating our pelvis from our spine. So we're right here. We can take our other hand, block it off, stretch for 2 minutes. Okay, now we're going to push our knees, push our knees into our hand, push, and this would be our pail. Okay, and then our rail, we trying to push our knees down, and if our shoulder, we're also simultaneously pushing our trunk the other way. And that's really working on that rotation piece. If we wanted to work our wrist extents, so we'll move on to our elbows. For our elbows, what we would do is, it's essentially just right here. I think for a lot of people, you may get more so a soft tissue and feel, and obviously for that person, it's not indicated, or if somebody, is getting that full range of motion into extension, it's not indicated. But let's say we were stuck here, an extension. So we're stretching, stretching, stretching for 2 minutes, right? You may even want to do it down here so the other tissues don't get involved. So this is for elbow extension. Now we're going to push into our hand and hold that for 20 seconds. And now we're doing our rail. So we can kind of support our elbow and really try to get that extension. If we were looking to get more flexion, then we can work on our 2-joint muscle, which is our triceps. Simple overhead tricep stretch is a good one, right? So you can be right here and we're stretching and we're stretching and we're stretching. Now if we can hook our opposite wrist like this, now we're going to push. We're trying to bring our elbow down. We're trying to bring our hand, we're trying to bring our hand into extension at the same time. So I'm holding that right here. And hopefully this doesn't give you too much impingement. But if it does, you can bring that out to the side as well. And then from here, we should be able to, we're doing our rails into more flexion like that. So that would work on the elbow. If we were working on our wrists and forearms, what we could do, same towel as before, right? So we would wrap it around and we would go into pronation and supination, right? So if I'm doing supination, we would educate our patient, hey, we don't really want too much ulnar radial deviation, keep that straight, right? And if I have a wrap underneath the back of my hand, like this, now I'm trying to get supination. See? So I can pull up on the towel, getting forearm supination, and then all I have to do, pull into pronation for that pail, and then pull down into that supination for our rail. And again, we want to be in end range, so this is a little bit too much motion, but this is my pail, and that's my rail. It's hard to see at end range, obviously. If we were going to do pronation, then we would just wrap it the other way, whereas if we went this way, now we'll just wrap the towel the other way, right? So same thing, and we just pull down. Hold this for 2 minutes, okay? As you can see, now we'll go into supination. There's my pail, and here's my rail. So you can actually see I got a bit more. That's more so like a PNF contract, relax. So I'd actually do my pail here, and then my rail will be the other way. Okay, last but not least, we can work on our wrist. So if we were working to, let's say, get wrist extension, right? We're trying to stretch out those wrist flexors. Let's see. Okay, so I have a little lip back here, the table. So I can position my palm down, and I got my fingers pointed behind me. And now I could just kind of walk out and sit down into it. And that's really stretching my flexors. So I'll lower the camera a little bit so you can see a little easier. So I'm right here. Arm straight. Sit down into it. Good. That's a nice stretch. I'm in a staggered stance. Now I'm going to push my fingers into the table like this. Push, 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 push. And then my rail is to come all the way up. And since I'm at end range, I can't. Same kind of concept. The rail is a quicker contraction. The pail is a little bit longer just to set that central nervous system and make sure that you're getting that full range and increasing it and showing your central nervous system that you can maintain it. So when it comes to this concept, there are certain ways where we can kind of like manipulate the intensity, and that's not just through increased times, increased stretch, but it's also through kind of like increasing the stability or decreasing the stability, positioning against gravity versus with gravity, or kind of like gravity eliminated at all. So when you're thinking about all these different variables, like I could do this wrist flexion stretch in half kneeling. Now that's really working that stabilizing component. I could even do a radiation there where I put a little ball or something and now I'm squeezing my knees together. things like that. And I really have to, it changes the stability component of all that. If I had a patient and they maybe couldn't go overhead actively for the shoulder stretch, the lat stretch, well, now I could kind of have them do it laying down. So for a supine, the contraction is actually with gravity. It's less threatening. Not only does it change the stability components, it's a lot more of a stable positioning there. But now we're going with gravity, and we can get that contraction with our rail because we're still pushing into the bed. If it were to look something like this, right? So we're pushing into our bed. We can just put our other arm here and push into it. And now when we go into our rail, it's it's less likely to have a painful component. So changing up the stability, changing up the positioning and things like that, how you're getting irradiation from different body parts. These are all ways that we can manipulate this and hopefully progress our patient over time.